In my experience, the women who benefit most from this type of surgery are the ones who come in saying that their breasts are disproportionately large to their body frame. Some, but not all, may experience upper back and neck pain, and some may get grooving of their bra straps. Many tell me that they struggle to fit into clothes comfortably, and in fact, some may even be socially embarrassed by it, hiding their upper body frame behind baggy clothes. Some can also complain that the size of their breasts limits their ability to exercise or do certain physical activities. So if a couple of things that I'm saying is ringing some bells with you, then have a chat to a plastic surgeon about whether breast reduction surgery is right for you. So the first thing to say is, you may not get the cup size that you're after. And this is to do more with bra manufacturers than it does breast reduction surgery. And what I mean by this is, I could pop down to the local Marks and Spencer's and fit a 38 double D bra, but if I then go to Brovissimo next door, I would fit a different cup size. So what I'm trying to say is, have a dialogue with your surgeon as to what your goals for surgery are, and maybe even look together with your surgeon at some clinical photos of women who've had breast reduction surgery and are now a D size or double D, and see what look you prefer. Right after surgery, one would expect that your nipple sensitivity is low. And the reason for that is because you've had some local anesthetic put in, but also because we've resected, taken away breast tissue. So this affects the sensitivity of your nipple. This can improve with time, but you should anticipate that you may not gain full sensitivity back, or some people even complain about heightened sensitivity. Now, if you've had breast reduction surgery, particularly if you've had a large breast reduction surgery where they've taken away a lot of breast tissue, then this may impact your ability to breastfeed. I'd say that if this is something that is part of your future, make sure you mention this to your surgeon, because then there are things that we can do to try and limit this risk. If you're currently on an exercise regimen and you haven't quite reached your ideal body weight, then put off surgery until you've reached your target weight and when you've been weight stable for at least 1 year. The reason for this is there's no point to fork out all this money, have the breast reduction surgery, and then lose more weight, because then your breasts will get even saggier. Okay, much better to have your ideal body weight stabilized, and then you can have the surgery and have the outcome that you want. So if you're deciding to have a family later on in life, then you may want to put off having breast reduction surgery, because for the same reason as before, your breast can grow larger during pregnancy and during breastfeeding, and this typically deflates after your pregnancy.